Good morning, sir. Good morning, ma'am.
Good morning.
Good morning, ma'am. Good morning, ma'am. Good morning, ma'am. Good morning, ma'am.
Good morning, ma'am.
Good morning, ma'am.
Good morning, ma'am. सुनाई तो देनी थी। सुनाई दे रहा है नहीं बोल रहे होंगे कुछ। We are about to start in 2 minutes. Good morning, okay, sir. Sure, sir. Okay, sir. Good morning, sir. म्यूट है बोल सकता हूँ।
Hello.
Good afternoon, sir. Good afternoon, sir.
Good afternoon, sir.
Afternoon, sir.
Good afternoon, sir.
Good afternoon, sir. Good afternoon, sir. Good afternoon, sir.
Good afternoon, sir.
Good afternoon, sir. Good afternoon, sir.
Please, everyone, mute yourself. Ma'am, you can start now.
Sure. So I request everyone to put themselves on mute now. Good afternoon to the panels of doctors from Team Medanta, dear parents, students, and colleagues. We all have had an unprecedented year full of challenges that shook the world. It put a brake on the speeding lives and made us all sit back and reflect, where were we going? Health became the priority for one and all. We saw the havoc of COVID 19 world over and how bravely and selflessly the medical teams fought it and are still doing the same. The scare is not completely over yet, but the world has to go on. Life has to go on. Education has to go on. The government is now opening schools, and hence we are ready and committed to take all possible precautions to make it safe for children to come and study. Obviously, there are so many questions in our mind, so we thought of organizing a webinar with Team Medanta, who has been relentlessly working to fight the menace. Today, we have a team headed by Dr. Sunit Sangi, chairman who is a pediatrician of international repute and a global leader in pediatric intensive care. He has successfully established India's first pediatric intensive care unit in 1992. He is a fellow of American College of Critical Care and Indian Academy of Pediatrics. He has also been a visiting professor to Boston's Children's Hospital and Astrid Lindgren Children's Hospital in Sweden. He also has the credit of developing India's first DM course in pediatric critical care. His career has been so illustrious, so who better than him to guide our parents and children how to create a COVID safe environment? Today we have students from Happy Hour School Pitampura, KIT World School Pitampura, KIT World School Junior Sector 46 and KIT World School Sona Road. We welcome you all, Dr. Singhi, to take over now and guide us how to do so. Over to you, sir.
Thank you, ma'am. And good afternoon, all children.
Good
And
afternoon,
their
sir.
parents.
Good afternoon, sir.
Good afternoon.
Good afternoon, sir.
Good afternoon, sir.
So,
Good afternoon, sir.
Good afternoon, sir. Good afternoon.
have you all started school now?
No, sir.
No, sir.
Sir, at Gurgaon campus, we have opened from grade 6 onwards, grade 6 to 10th classes are now at campus.
So all of you are still at home, huh?
Yeah, most of them are.
Okay. How many of you all of you want to go to school, or you want to stay at home?
Go to school. Sir, I want to go
To school.
I want to stay at home.
Okay. So when you go to school,
Sir, I go to school.
when you go to school, your mom and dad are.
I go to school.
Hmm.
Yes, ma'am.
They are going to get worried. Mom and dad are going to get worried.
I want to go to school.
All right, students, let us
Okay, let
put
us
ourselves on mute, please. Everyone on mute, please. Let sir speak now.
Sir, you are mute.
Sir, you are muted.
Yeah, ma'am muted me also, not only you. Okay, so when you go to school, the concern of the parents, your parents are really genuine. They want to know you are safe in that school and you stay healthy. But I will pick up both these aspects: how you stay healthy at home and how you stay healthy in school and stay safe from COVID, right? So what had you been doing at home for staying healthy? Okay. And when you go to school, how you remain safe? COVID related precautions are same anywhere, whether you are in school, you are in a mall, you are in a family, you are in a society, anywhere. That means you maintain those precautions of having mask on, keeping a distance, washing your hands, using a sanitizer every time you touch yourself, and avoid large groups. That means crowding. But your school rooms, I know, are not crowded. So that's fine with you. You can go to school once the government takes a decision on that, while observing these precautions. And in school, of course, the principal ma'am will take care that the rooms are sanitized every day after every class, and all the teachers will follow the same precautions as you would be, and your mom and dad must be observing, right? So concern for your health is paramount in your mom's and dad's mind, your teachers, your principal ma'am, and of course all of us in working as doctors or healthcare workers. So how do you stay healthy? That is what we will be talking also later. And how do you stay healthy? By eating well, by remaining active, and by regularly getting your medical checkup to prevent all health issues, your vaccinations, immunizations, and so many things that a doctor's checkup brings to you, right? So start from home. Let me ask you one thing. What had you been doing at home in these last last 10 months, which had been really unprecedented, as the principal ma'am has said? Were you eating all right? How were you keeping yourself physically active? Yoga. Wow. What else? What else were you doing? Yes. Avoiding crowding, increasing immunity, exercise. I think two things that are very important during this time when you are staying at home is eating properly. And my colleague Monica will be talking with you about how to eat healthy and how to eat well. And second is keeping yourself physically active. So what are the things that you can do at home? Have you been playing around, biking outside in your society or apartment area, or you can do that? Even inside home, you can do all kind of exercises. Yoga, of course, is one, but you can do jumping. Children at your age, many of you like to jump and master that activity. So keeping physically fit is very important, and that is through exercise and, of course, participating with your mom and dad in household chores. You can help them in the household work, which is, you can also help with the gardening, you can help them in fetching things that they need. That will keep you physically active, and physical activity is very important to remain mentally healthy. I think many of you were stressed because you are not able to go out, you were not able to play with your friends, and that can be taken care when you are physically active. And that can save you from, during COVID time, from stress, which can really be difficult to handle sometimes. And of course, if you really feel something, talking with mom and dad is very important. They can help you to understand what is going on. And playing with other children, now you can do it in small groups. You can also go to the nearby garden or lawn, or where you can do a little running, you can do your biking. And one thing which I would like to ask you during this time, when you are not going to school, studying at home and online is, of course, the way everywhere it has been done. But what I want to ask you is to avoid sitting in front of TV or using your phone, etc., for a longer period, because that leads to a lot of health issues. I mean, one, because of just sitting and gaining unnecessary weight. Second is, because of that, you are all the time preoccupied. You are playing your video games, you are playing something on TV, you are watching something, and all of that is very unproductive. Not physically helping your health, not mentally helping your health. Yes, once in a while, and maybe half an hour, 45 minutes. American Academy of Pediatrics clearly recommend that children at your age should not be using screen time for all such things, except the education, for more than 45 minutes to 1.5 hours. And that's very important, because that otherwise will deprive you of physical activity and your good health. Okay? So during this time, whether at home or in school, spend time playing with each other. Of course, uh, when friends are not around, you will feel bored, but then there are ways to keep yourself occupied. Indoor games, indoor physical activity, those can be very helpful. But sitting and doing something which is not productive is not good, not good for your health, not good for your mental health. Okay. The second thing which is in relation to your good health, which is important, is regular, I have already told you, in relation to your health, activity and food. Second thing is regular medical checkups to prevent any issues. Doctor can see you, see your growth is going on well, because growth is the most important parameter most important indicator that you are generally well or not. Of course, the other things also need to be seen, but if you are growing in height, growing in weight normally, which at this age should be 2 to 3 kilogram in a year, and if you are gaining more like that, then you are probably overeating or not exercising. And your height, if it is growing properly, then your growth is good and you are healthy. So take regular, this is for parents also. The child should be taken for regular physical checkup once in 3 to 6 months for all preventive health care. During this time, they can examine the child, see if there is anything that is coming up, take care of it before it gets any worse. And during this time, actually speaking, some of the health problems got exacerbated or increased because children were all the time indoor and they were not physically active. Especially in early teenagers, 10, 11, 12 years old children, there were certain diseases that cropped up. And they were seen by us only when they had really were in florid form or had gone really bad. But if they were examined in time, things can be. So any one of you, any child, any is not feeling well, having fever, having any, even a change in diet habit, change in behavior, this should be brought to the medical attention. During this time, psychological stress in children had been quite high. And as I said, the way to overcome is physical activity, proper diet, proper sleep. During this time also, some of the children were not following, and I think the parents are also equally responsible for it, is their sleep pattern. They were sleeping late, getting up late, and not sleeping adequately. And not sleeping adequately always leads to overeating. So one thing leads to another. Good sleep is fundamental to good health, besides the proper diet and exercise. Okay? So you can stay safe by following the few advice that eat well, sleep well, remain active, don't sit and watch your TV or phones beyond 1 hour or so. Get to play with your friends in your area, like some of you are going to tuition, that's very good, but you need to remain active. Okay, that is going to be good for your physical health. And if you feel any time that you are feeling something unusual, uneasy, tell your mom and dad so that mom and dad can take you to the doctor. Don't wait for anything. Okay, things may sound very trivial, but it is still good to see a doctor. And of course, you will also hear from my colleagues about how to eat well, what should be the right eating habit, and they will also tell you how to take care of teeth. Teeth issues are really very, very important. Again, at this age, one of the most common problems are teeth-related caries, and how you can look after them, you should know. I hope all of you do brushing twice a day and after meals. I want to see yes there in the chat. No? Okay. Learn to do that. But I will be happy if some of you are doing it. Because once you realize it late, the teeth are already gone. The caries have already taken them over. And at your age, the teeth are not the one which are non-permanent or milk teeth. They are permanent teeth. So take care of your dental health. So if there anything that you would like to ask me, I have not touched upon what are the common health issues at this time. I think right now the concern is only and majorly for COVID, and any other health issue that you feel, bring it to your parents' attention. Immunization also need to be done, so always regular visits to a doctor are important. If you are not finding any doctor anywhere, we at Medanta had been all the time open for everyone. Okay? So thank you very much for giving me this time and opportunity to talk with you. And I hope some of these things will be helpful to you. You will try to follow some. And if you have any query, question, you can ask now or later, whenever you want. Thank you. Thank you, ma'am.
Thank you so much, sir. So thank you so much. So now I request Dr. Monica. She will be telling you about the eating habits for students. Dr. Monica, please.
Hello, am I audible?
Yes, ma'am.
Good afternoon, everyone. Yeah, thank you so much for giving me the opportunity to talk on this topic. So today's my topic is healthy eating for students. Basically, nutrition जो है बहुत ही important part है बच्चों के लिए.
Ma'am, your camera is not working.
Okay.
And voice is breaking due to that.
Now I think is it okay?
Can't see you, ma'am. Yes, yes.
Okay. My topic is healthy eating for students. So due to COVID, health is very affected. न्यूट्रिशन जो है बहुत इंपॉर्टेंट रोल प्ले करता है बच्चों की हेल्थ के लिए, ओवरऑल न्यूट्रिशन डेवलपमेंट के लिए, मेंटल डेवलपमेंट के लिए, हेल्थ फिजिकल डेवलपमेंट के लिए. तो आज हम ये देखेंगे कि हम डाइट में कौन कौन सी चीजें इंक्लूड करें जिससे हम बच्चों की हेल्थ को इंप्रूव कर सकते हैं. तो फर्स्ट इज हेल्दी ईटिंग अ डिफिकल्ट चॉइस. तो मैं बच्चों से पूछना चाहूंगी या जो पेरेंट्स जिन्होंने ज्वाइन किया हुआ है, क्या हेल्दी ईटिंग आज के सिनेरियो में डिफिकल्ट चॉइस है? क्योंकि जो बच्चे हैं वो आजकल हेल्दी फूड की जगह जो हमारा ट्रेडिशनल फूड था, रोटी सब्जी दाल चावल, उनकी जगह बर्गर.
आज ये क्या कर रही है?
हेलो. सो आई एम रिपीटिंग अगेन, हेल्दी ईटिंग अ डिफिकल्ट चॉइस. क्या आजकल जो हम डाइट में हेल्दी चीजें इंक्लूड कर रहे हैं, क्या वो मुश्किल हो रहा है? आजकल जो बच्चे हैं डाइट के अंदर जितना भी स्टफ है, जंक फूड है, उनको डाइट में ज्यादा इंक्लूड कर रहे हैं, तो उनके लिए एक बहुत टफ चॉइस बन गया है कि किन चीजों को वो डाइट में इंक्लूड करें. सो हेल्थ कम फ्रॉम, हेल्थ कहाँ से आती है? Hello, sorry for this. Now I'm starting again. Today's my topic is healthy eating for student. न्यूट्रिशन जो है वो डाइट में एक बहुत इंपॉर्टेंट रोल प्ले करता है बच्चों के डेवलपमेंट के लिए, फिजिकल एंड मेंटल डेवलपमेंट दोनों के लिए। तो डाइट में हेल्दी फूड का होना बहुत जरूरी है, क्योंकि जितना ही बेटर न्यूट्रिशन होगा बच्चों का फिजिकल डेवलपमेंट के साथ साथ उनका जो मेंटल एबिलिटी है वो इंक्रीज होती है। किसी भी चीज को याद रखने की जो पावर होती है, रिटेन जो मेमोरी रिटेन की जो पावर होती है वो इनहांस होती है। So let's start with this. Next नहीं हो रहा। Okay. Healthy eating a difficult choice. आज के सिनेरियो में हेल्दी ईटिंग जो है वो एक बहुत ही डिफिकल्ट चॉइस बन गई है फॉर द किड्स एंड द पेरेंट्स बोथ, क्योंकि बच्चे आजकल नॉर्मल ट्रेडिशनल फूड जैसे रोटी सब्जी दाल चावल की जगह बर्गर पिज्जा इन सब चीजों को प्रेफर करते हैं, जो कि उनकी हेल्थ को बहुत इफेक्ट करता है। तो व्हाट इज हेल्थ? हेल्थ आती कहाँ से है? जैसे कि डॉक्टर सांघवी ने पहले ही बताया कि हेल्थ जो है वो कई चीजों से मिलकर बनी है। इसमें आती है हेल्दी ईटिंग, रेगुलर फिजिकल एक्टिविटी, साउंड स्लीप, हेल्दी इंटरेक्शन विद द पीपल। बट आजकल कोविड सिनेरियो में हम इन सब चीजों को जो है अपना पूरा नहीं कर पा रहे हैं। इनमें से कुछ चीजें हम अचीव कर रहे हैं, बाकी चीजों हम अचीव नहीं कर पा रहे हैं। जिनमें से अभी बच्चे हाँ साउंड स्लीप ले रहे हैं, प्रॉपर सैनिटाइज और हाइजीन और सैनिटेशन का ध्यान रख रहे हैं, बट अभी बच्चे जब घर में है तो उनकी ना तो फिजिकल एक्टिविटी हो रही है, अभी बच्चों का ना तो सोशल इंटरेक्शन है, तो बहुत ही वो लोनलीनेस फील करते हैं। तो इसके साथ अगर हम डाइट के अंदर कुछ चेंजेस कर सकते हैं तो हाँ हम हेल्थ को अचीव करने में हेल्प कर सकते हैं। आजकल जो बच्चे जंक फूड खा रहे हैं उसके बहुत ज्यादा हार्मफुल इफेक्ट हैं। जंक फूड से बच्चों में आजकल जो हमारे नंबर ऑफ पेशेंट्स भी जो किड्स हैं वो इंक्रीज हो रहे हैं। उनमें क्या हम देखते हैं आजकल एनीमिया, ओबेसिटी, विटामिन डेफिशिएंसी, लैक ऑफ कंसंट्रेशन, फटीग, इन सब के मेंटल डेवलपमेंट। तो व्हाट इज हेल्दी? हेल्दी ईटिंग है क्या? हम खाने में क्या चीजें इंक्लूड करें जिससे हमारी हेल्थ जो बेटर हो सके। फर्स्ट इज है ऑप्टिमम फाइबर, होल ग्रेन सीरियल्स, पल्सेस, फ्रूट एंड वेजिटेबल्स। जो वेजिटेबल्स होल ग्रेन्स के मतलब आप अपने खाने के अंदर जितना भी साबुत अनाज है, मतलब चावल, दलिया, गेहूं, रोटी, इन सब चीजों को इंक्लूड करेंगे। ये आपकी मेंटल पावर को इनहांस करता है। होल पल्सेस मीन साबुत दालें। जितनी भी दालें होती हैं दे आर द गुड सोर्स ऑफ प्रोटीन। ओमेगा 3 फैटी एसिड जो है ब्रेन डेवलपमेंट में बहुत इंपॉर्टेंट रोल प्ले करता है। वेजिटेबल्स एंड फ्रूट्स, वेजिटेबल्स जो है आपको फटीग से बचाते हैं और फ्रूट्स जो है उसमें एंटीऑक्सीडेंट होते हैं, जो कि आपके ओवरऑल डेवलपमेंट के लिए बहुत अच्छे हैं। नेक्स्ट इज लो फैट, शुगर एंड सॉल्ट। आजकल बच्चे जो भी फास्ट फूड खाते हैं, जंक फूड खाते हैं, उनमें फैट कंटेंट बहुत ज्यादा होता है, शुगर एंड सॉल्ट। शुगर्स जो है जितनी भी शुगरी ड्रिंक्स है, कोला है, शरबत है, जितने भी ड्रिंक्स हैं उनमें बहुत ज्यादा होता है, जो कि ब्रेन में इंफ्लेमेशन करता है और ब्रेन डेवलपमेंट के लिए प्रॉपर फंक्शनिंग के लिए प्रॉपर ठीक नहीं है। इसलिए डाइट शुड बी लो फैट, शुगर एंड सॉल्ट। स्मॉल एंड फ्रीक्वेंट मील्स, ये भी बहुत जरूरी है कि बच्चे जो अपना डाइट लें कम से कम उसमें 5 से 6 छोटे छोटे मील्स हो। जैसे अभी बच्चे घर पे हैं तो वो ये कर सकते हैं कि बिफोर स्टार्टिंग देयर क्लासेस वो एक अपना ब्रेकफास्ट कर लें, आफ्टर देयर क्लासेस वो एक फ्रूट ले लें, उसके बाद अपना लंच करें, शाम को 4:35 अराउंड एक छोटा सा स्नैक एंड देन डिनर। इससे क्या होगा, बच्चे जब थोड़ा थोड़ा खाते हैं तो खाने का जो डाइजेशन है वो प्रॉपर तरीके से होता है। लेस प्रोसेस्ड एंड प्रिजर्व फूड, जितने भी मार्केट के चिप्स हैं, कोल्ड ड्रिंक्स हैं, ये सब चीजें बहुत ही प्रिजर्व और प्रोसेस्ड होती हैं। जैसे बच्चे आजकल जैम, जेलीज, अचार, पापड़, पिकल्स इनका बहुत यूज कर रहे हैं। तो ये सब चीजें भी बच्चों में ओबेसिटी को इंक्रीज करती हैं और न्यूट्रिएंट एब्जॉर्प्शन को इनहिबिट करती हैं। नेक्स्ट मोस्ट इंपॉर्टेंट थिंग इज ईटिंग एट राइट टाइम। जैसे एक हेल्दी खाना बहुत जरूरी है, ऐसे खाने को समय पे खाना भी बहुत जरूरी है। इसलिए जरूरी है कि आप एक टाइम, एज ए पेरेंट्स आप क्या कर सकते हैं, टाइम फिक्स रख ले कि इतने बजे आपने ब्रेकफास्ट करना है, इतने बजे लंच करना है और इतने बजे डिनर करना है और मिड मील आपके स्नैक्स हो जाने चाहिए। इससे क्या होगा, आपकी बॉडी को हर टाइप के न्यूट्रिएंट मिलेंगे। ईटिंग विद फैमिली, नॉट विद डोरेमोन। आजकल जो बच्चे हैं बेसिकली हमने देखा है कि वो टीवी देखते हुए खाना खाते हैं। तो उससे क्या है, जब टीवी देखते हुए खाना खाते हैं तो न्यूट्रिएंट का प्रॉपर एब्जॉर्प्शन नहीं होता और बच्चे को नहीं पता होता कि वो क्या खा रहे हैं, तो फूड से अपने आप को रिलेट वो नहीं कर पाते। तो इसलिए जरूरी है कि खाना खाते हुए बच्चे टीवी ना देखें, उस टाइम को, खाना खाने वाले टाइम को अपनी फैमिली के साथ एंजॉय करें। वॉशिंग हैंड बिफोर एंड आफ्टर ईटिंग, ये तो आजकल कोविड सिनेरियो में सब बच्चे कर रहे हैं, जो कि बहुत ही अच्छी बात है, और ये भी बहुत इंपॉर्टेंट एक सिनेरियो है हेल्दी ईटिंग का। नेक्स्ट इज मोर फ्लूइड 6 to 8 ग्लासेस पर डे। बच्चे आजकल घर में हैं, विंटर्स है, वाटर इनटेक बच्चों का बहुत कम हो गया। पानी भी जो है बहुत इंपॉर्टेंट रोल प्ले करता है ओवरऑल हेल्थ के अंदर। तो बच्चे पानी का इंटेक बढ़ाएं। अगर प्लेन पानी नहीं पी सकते तो वो जैसे फ्रेश लाइम ले सकते हैं, कोकोनट वाटर ले सकते हैं, सूप इंक्लूड कर सकते हैं, बटर मिल्क या मिल्क शेक। सो हाउ शुड योर प्लेट लुक लाइक? एक प्लेट खाने की कैसे दिखनी चाहिए? हमारी खाने की प्लेट ऐसे दिखनी चाहिए जिसमें हाफ ऑफ प्लेट होनी चाहिए फ्रूट एंड वेजिटेबल्स की, जिसमें आपके जितने आप कलर्स यूज करेंगे उतने ही आपको बेटर रहेगा, उतने ही आपको खाने में एंटीऑक्सीडेंट्स मिलेंगे। आपकी 1/4 प्लेट होनी चाहिए प्रोटीन्स की। प्रोटीन्स में आपकी दालें हो सकती हैं, आपकी दही हो सकती है, पनीर हो सकता है, एग हो सकता है, एंड 1/4 प्लेट होनी चाहिए आपकी ग्रेन्स की। ग्रेन्स के अंदर आपकी रोटी, दलिया, राइस कुछ भी हो सकता है। तो ये एक हेल्दी प्लेट है। आपकी प्लेट जो है वो ऐसे दिखनी चाहिए। नेक्स्ट, अ फ्यू हेल्दी टिप्स फ्रॉम माय साइड। प्रीफर होल व्हीट और मिक्स ग्रेन वर्जन ओवर मैदा। मैदा से बनी चीजों को आपको अवॉइड करना है, क्योंकि वो न्यूट्रिशन एब्जॉर्प्शन जो है, उनमें फाइबर जो कंटेंट है बहुत कम रहता है। उसकी जगह आप होल व्हीट प्रोडक्ट यूज कर सकते हैं। जैसे अगर आपको पास्ता खाना है, इंस्टेड ऑफ व्हाइट पास्ता यू कैन प्रीफर होल व्हीट पास्ता विद लॉट्स ऑफ वेजिटेबल्स। Consider having salad, soup and fruits with lunch and dinner. Snack on unprocessed fresh food. जैसे आप शाम के टाइम कुछ स्नैकिंग करते हैं, चिप्स की कोलाज लेते हैं या कुछ भी आप अनप्रोसेस्ड चीजें लेते हैं, उसकी जगह आप फ्रूट्स ले सकते हैं। शाम के टाइम बच्चे कुछ जैसे रोस्टेड चना है, रोस्टेड मखाना है, आप इन सब चीजों को डाइट में इंक्लूड कर सकते हैं। इंक्लूड प्रोटीन एंड डेयरी फूड आइटम्स। प्रोटीन जो है बहुत ही इंपॉर्टेंट रोल प्ले करता है बच्चों की मसल डेवलपमेंट के लिए, और ये वो स्टेज है जब बच्चों को प्रोटीन की रिक्वायरमेंट होती है। तो प्रोटीन आपको इंक्लूड करना जरूरी है। प्रोटीन जो मेन सोर्स है वो है पल्सेस और डेयरी फूड्स, या अगर नॉन वेजिटेरियन है तो नॉन वेज जो है एग्स है, चिकन एंड फिश है, वहां से भी आप प्रोटीन ले सकते हैं। जैसे मैंने पहले भी बताया कि आपको जितने भी डेयरी प्रोडक्ट्स हैं वो इंक्लूड करने हैं, बट चिप्स, बिस्किट, अनप्रोसेस्ड फूड जितने भी हैं इनको आपने अवॉइड करना है। एंड अभी आप घर में हैं, बाहर इतना खेलने नहीं जा पा रहे छोटे बच्चे, तो जो भी आप खा रहे हैं उसे बैलेंस करने के लिए आपको खेलना जरूरी है। ऐसा नहीं है कि अभी आप ऑनलाइन स्टडीज कर रहे हैं, आपका वैसे भी स्क्रीन टाइम इंक्रीज हो गया, आप जो भी खाएं उसको बैलेंस करने के लिए या तो आप फिजिकल एक्टिविटी करेंगे या थोड़ा सा आप घर में ही थोड़ा योगा या आप एरोबिक्स या डांस कुछ भी आप कर सकते हैं। नाउ आई एम शेयरिंग सम हेल्दी लंच बॉक्स आइडियाज। जैसे बच्चे स्कूल जाना शुरू करेंगे तो उनकी लंच बॉक्स में आप क्या क्या चीजें दे सकते हैं। यू कैन पुट स्टफ्ड पराठा। स्टफ्ड पराठा में भी कोई भी पराठा विद एनी वेजिटेबल, आप गोभी का पराठा या कोई भी ग्रीन लीफ वेजिटेबल या पनीर पराठा उनके लंच में रख सकते हैं। नेक्स्ट इज वेजिटेबल चीला। वेजिटेबल बेसन चीला हो सकता है, ओट्स चीला या मल्टीग्रेन चीला। वेजिटेबल होल व्हीट पास्ता इंस्टेड ऑफ व्हाइट पास्ता विद लॉट्स ऑफ वेजिटेबल। वेजिटेबल उत्पम, अगेन वेजिटेबल आपने इंकॉर्पोरेट करनी है उनके हर मील में। वेजिटेबल इडली, फ्रूट्स एंड कॉर्न सैलेड, boiled chana salad. So up end of my slide, the choice of the kids. So according to me, we are what we eat. जो हम खाते हैं हम वैसा ही होते हैं। The choice is now kids is yours. कि आप बर्गर खा रहे हैं तो आप कुछ टाइम में बर्गर जैसे दिखेंगे, और if you are eating healthy vegetables like spinach, green leaf vegetable, तो आप पपाई जैसे ही strong हो जाएंगे mentally and physically. Thank you so much.
Thank you very much, ma'am. Now I'll ask if there is any question, please raise hand or ask it in the chat box, please. Ma'am, there are some questions. In the chat box, ma'am.
Any questions, please?
Ma'am, there are some questions in the chat box.
Okay, but यहाँ show नहीं हो रहा है.
Okay, just screen share off करना पड़ेगा. Yeah.
Yes, now showing. Yes.
Yes.
Yes, I'm seeing the question. How can I increase weight? So increase weight को increase करने के लिए आज हम देखते हैं कि डाइट में बच्चों में प्रोटीन्स का इंटेक बहुत कम हो गया है. तो आपको ये ध्यान रखना है कि हमने डाइट में प्रोटीन्स के इंटेक को बढ़ाना है, क्योंकि हमने बच्चों में फैट का कंटेंट नहीं बढ़ाना, हमने बच्चों में मसल्स का कंटेंट बढ़ाना है जो कि वेट पे हेल्प करेगा. तो आपको ये ध्यान रखना है कि बच्चे की हर मील में प्रोटीन्स हो. अगर वो ब्रेकफास्ट कर रहा है तो ब्रेकफास्ट में कुछ प्रोटीन से रिलेटेड चीजें, जैसे अगर वेजिटेरियन है तो वो पनीर ले सकता है, नॉन वेजिटेरियन है तो एग ले सकता है. लंच के अंदर कर्ड या दाल जरूर हो, एंड सेम एज डिनर कर्ड एंड दाल. मतलब हर मील में प्रोटीन होना बहुत जरूरी है. ओके, हाउ टू लूज वेट. या वेट लूज करने के लिए छोटे बच्चों का यही है कि उनको आप फिजिकल एक्टिविटी में इन्वॉल्व करेंगे, उनको बोलेंगे कि हाँ थोड़ा टाइम फिजिकल एक्टिविटी के लिए चाहिए. बच्चों में आजकल जो ऑनलाइन क्लासेस की वजह से तो स्क्रीन टाइम इंक्रीज हो गया, उनकी फिजिकल एक्टिविटी बहुत कम हो गई है. तो एज ए पेरेंट्स आप भी कर सकते हैं कि हम दोनों एक्सरसाइज करेंगे, तो आप थोड़ा सा 10-15 मिनट आप निकालें, स्टार्ट करें 10-15 मिनट से, और एटलीस्ट 30 मिनट की एक्टिविटी तो बच्चे की होनी चाहिए. ओके, कोई पेरेंट्स पूछ रहे हैं कि हेल्दी ईटिंग को कैसे इंकॉर्पोरेट करें बच्चों के डाइट के अंदर. हाँ, बहुत मुश्किल होता है इनिशियली कि बच्चे जो ग्रीन लीफ वेजिटेबल नहीं खा रहे उनको डाइट के अंदर लीफी वेजिटेबल को इंक्लूड करवाना. आप ये कर सकते हैं कि बच्चे का ग्रीन लीफी वेजिटेबल नहीं खा रहे तो इंस्टेड ऑफ दिस आप क्या कर सकते हैं, उसकी प्यूरी बना सकते हैं. स्पिनच की आप प्यूरी बना के आप आटे में गूंथ सकते हैं, उसकी आप रोटी या पराठा बना सकते हैं. तो बच्चों को आप कह सकते हैं कि आज हमने ग्रीन पराठा बनाया, आज हमने पिंक पराठा बनाया, बीटरूट पराठा बना सकते हैं. तो ये आपकी क्रिएटिविटी है कि आप किस तरीके से इन चीजों को डाइट में इंक्लूड करें. बहुत सारे पेरेंट्स पूछ रहे हैं हाउ टू इंक्रीज हाइट. तो हाइट इंक्रीज करने के लिए ये है कि आपको गुड न्यूट्रिशन के साथ साथ जो है फिजिकल एक्टिविटी में इन्वॉल्व होना पड़ेगा थोड़ी, क्योंकि फिजिकल एक्टिविटी लाइक स्ट्रेचिंग कर सकते हैं, स्ट्रेचिंग या योगा, वो सब चीजें जो हैं आपकी हाइट इंक्रीज करने में, बच्चे की हाइट इंक्रीज करने में हेल्प करेगी. किसी पेरेंट्स ने पूछा है कि हम बच्चों को कैसे बोले कि हेल्दी ईटिंग नहीं. तो एक्चुअली उसके लिए ये है कि हमें अगर बच्चों को हेल्दी ईटिंग सिखानी है तो उसकी शुरुआत हमें घर से ही करनी पड़ेगी, क्योंकि बीइंग ए मदर अगर आप हेल्दी ईटिंग अपना रहे हैं, आप भी वही खा रहे हैं जो बच्चा खाएगा, तो डेफिनेटली बच्चा भी खाएगा. बच्चों के लिए आप चॉइस ना रखें कि आज अच्छा ये नहीं खाना तो आपके लिए हम ये बना देंगे. उन्हें बोलो कि यही बना है और इसमें हमने ये चीज डाली है, इससे आपको ताकत मिलेगी, ये आपके लिए बहुत अच्छा है, आपकी हाइट बढ़ेगी. तो डेफिनेटली बच्चे भी सोचेंगे कि यही चीज अच्छी है, वो भी वही चीज खाएंगे. किसी पेरेंट्स ने पूछा कि व्हाट टू डू टू रिमूव स्पेक्स. सो स्पेक्स लगे हैं बच्चे को तो बहुत सारे रीजन हो सकते हैं. हाँ, बट डाइट में ये है कि जितनी भी विटामिन ए रिच चीजें हैं, जैसे आप अभी सीजन चल रहा है, स्पिनच है, कैरेट है, जितने भी ग्रीन वेजिटेबल्स हैं, दे आर रिच सोर्स ऑफ विटामिन ए. आप इन चीजों को इंक्लूड कर सकते हैं. बच्चों को घर पे फ्रेश वेजिटेबल जूस या फ्रूट जूस बना के आप दे सकते हैं, तो उनसे उनका विटामिन ए कंटेंट इंक्रीज होगा, तो उनकी जो है आई जो है वो पावर इंक्रीज होगी. यस, सोया, किसी पेरेंट ने पूछा है कि इज सोया चंक्स ए गुड ऑप्शन. यस, सोया चंक्स इज ए गुड ऑप्शन. आप इवनिंग स्नैक्स में उनको सोया चंक्स दे सकते हैं. आप कॉर्न सैलेड बना सकते हैं उनके लिए, आप बॉइल्ड चना सैलेड बना सकते हैं, या रोस्टेड चना है, रोस्टेड मुरमुरा है, ये सब आप उनके इवनिंग स्नैक्स में रख सकते हैं. यस, लेस टीवी, लेस मोबाइल फोन. यस, इट इज राइट. आप जब भी आप बच्चे खाना खाते हुए टीवी देखते हैं या मोबाइल फोन उनके हाथ में होता है, तो खाने का प्रॉपर डाइजेशन या एब्जॉर्प्शन नहीं होता. तो उसके लिए बहुत जरूरी है कि जब बच्चे जब भी खाना खाएं, आप उन्हें ये बोल सकते हैं कि अगर उन्हें टीवी देखना है या टीवी देखना है तो वो खाने के बाद देख सकते हैं, बट खाने के टाइम 15 से 20 मिनट जितने देर में वो खाना खा रहे हैं तो नो टीवी। किसी पर ने पूछा है कि सो आफ्टर हाउ मेनी डेज शुड वी ईट जंक फूड। तो फ्रॉम माय साइड जंक फूड को अवॉइड करना है। अगर आपको जंक फूड खाना है, फॉर एग्जांपल अगर हमने अपने बर्गर खाना है तो आप ये कर सकते हैं कि आप घर पे बर्गर बनवा सकते हैं पेरेंट्स से। बट हाँ, पेरेंट्स आप भी ये, अगर जैसे बर्गर बनाने के लिए बच्चा कह रहा है तो आप उसे बोलेंगे कि हाँ हम बर्गर बनाएंगे घर पे बट विद लॉट्स ऑफ वेजिटेबल। सिर्फ ये नहीं होगा कि हम बर्गर में सिर्फ आलू टिक्की रखेंगे और हम खा लेंगे, नहीं, अगर हम बर्गर ले रहे हैं तो विद आलू टिक्की एंड विद टोमेटो स्लाइस विद लेट्यूस एंड अनियन, आपने वेजिटेबल्स के साथ उसको खाना है। what should be include in everyday diet? एवरीडे की जो डाइट है उसके अंदर सारे न्यूट्रिएंट होने चाहिए। मींस आपको दालें, डेली डाइट में दाल होनी चाहिए, ग्रीन वेजिटेबल होनी चाहिए, रोटी सब्जी एंड फ्रूट्स जो है बहुत मस्ट है। दिन में बच्चों के लिए एटलीस्ट 2 फ्रूट इन अ डे तो होना ही चाहिए। और बच्चे अगर जूसेस पीना चाहें, अभी विंटर सीजन है तो होममेड जितना भी जूसेस है, फ्रूट जूसेस, वेजिटेबल जूसेस, वो ले सकते हैं। आटा मैगी इज हेल्दी नहीं, बाहर की कोई भी चीज हेल्दी नहीं है। इंस्टेड आप, क्योंकि उन बाहर की जो चीजों में प्रिजर्वेटिव मिले रहते हैं, तो आप इंस्टेड ऑफ आटा मैगी आप जो नॉर्मल वर्मिसेली आती है आप उसको लोट्स ऑफ वेजिटेबल्स के साथ बना सकते हैं। अगर बच्चा फिर भी नहीं खा रहा तो आप मैगी के अंदर अपने घर में जो खूब सारी वेजिटेबल ऐड करके आप मैगी बना के उनको दे सकते हैं। किड्स गोइंग टू रिमूव वेजिटेबल्स, यस। बच्चे जो है वो कई बार होता है कि सब्जी पसंद नहीं करते, वो खाने में से चीजें निकाल निकाल के बाहर रखते हैं। तो उसका सोल्यूशन यही है कि आपको जो पता है कि बच्चा जो वेजिटेबल नहीं खाता, फॉर एग्जाम्पल जैसे कोई बच्चा अगर दाल नहीं खाता तो पेरेंट्स क्या कर सकते हैं, उस दाल का पराठा बना सकते हैं बच्चों के लिए। कोई वेजिटेबल नहीं खाता तो उस वेजिटेबल को आटे में गूंथ सकते हैं। तो यही चीजें आप चेंज करके, बट हाँ उनको डेली देना जरूर है। अगर वो चीजें निकाल रहे हैं तो अपने उनको समझाना है कि ये चीजें क्यों जरूरी है और हम इनको डाइट में क्यों इंक्लूड करें। Yes, you can have carrot and beetroot juice on a daily basis, no issues.
So, ma'am, if you want, we can start with Dr. Saima now.
Yeah, sure.
एक सेकंड, आई जस्ट क्लोज योर।
So everyone, Dr. Saima Hussain is a doctor in our department, dental department here in Medanta Mediclinic. So, Dr. Saima, please.
शेयर स्क्रीन करना।
जूम पे जाओ पहले, जूम में कैमरा ऑन कर लेना।
Yeah, so good afternoon, everyone. Hi, kids. So everyone hates a dentist, but I hope you like me. I'm here like at a distance, and you don't really have to get yourself checked today. So just some information. Importance of oral health. change this? Just a little bit. Next. Okay, so basically, did all of you know that your oral health can actually give us clues about your real overall health? So any our oral cavity is just like any other organ in our system. We have our own natural flora where there's a lot of bacteria, which is actually good bacteria. So till a certain level, they are just right for our body. They provide the right amount of defense that our body needs because our body has quite a strong immunity. However, what happens is when we don't brush properly, when we don't really take care of our oral hygiene, these bacterial levels become high and they become a dangerous bacteria then. And that's what leads to all the oral infections like tooth decay, gum disease, bleeding from gums, mobile teeth, not the milk teeth that are supposed to go, but your main permanent teeth that, you know, with time a cavity will form solely because you have not brushed properly or flossed properly. So there is some myths and facts that I want to discuss. Does anyone know whether acid causes tooth decay? It does actually. So any kind of reflux that you have or any aerated drinks that you drink, all of them are acidic. So there are three layers in your teeth: enamel, dentine, and pulp. Pulp is where the nerves are, and enamel is the topmost layer. So what an acid does, it wears it off. And initially your white teeth start looking yellow. You'll know when you have a cavity. That's not really true because a lot of actually maximum of the initial cavities that are formed till now, that are formed initially, they do not have any kind of symptoms. There's no food lodgement, nothing. And it's only on your regular visit that a dentist will be able to tell you that you have a cavity. Chips and cracks in teeth lead to decay. Yes, again a fact, because any kind of crack or a fracture or a cavity in your teeth will harbor more bacteria and that will cause an infection which will lead to decays. Sensitivity in teeth means you have decay. Then that's a myth because some cavities can cause sensitivities, not all cavities. Your basic plaque deposit will lead to loosening of your gums that can cause sensitivity. You have to brush, floss, and rinse to prevent cavities. Prevention is the key. So, practicing good oral hygiene, what do we really need to do in that? We need to brush our teeth twice, floss daily. There are lots of excuses that I have heard about why one does not floss. We're going to discuss it soon. Eating a healthy diet, which, like Dr. Monica just explained, limiting in between meal snacks. Like if you're taking your sugars, I rather you take your sugars in one go. Like I know she said not to, but even if you are having your chocolates, make sure you're having it one time of the day. It's not like you're having it throughout the day. Replace toothbrush every 3 months. Make that a rule. It has to be 3 months. If your brush starts wearing off before 3 months, assume that you're being very hard on your brushing. You have to use an ultra soft bristle brush, and 3 months is the average when your brush should, after 3 months is when your brush should start wearing off. And regular checkups every 6 months, like make it a rule like every 6 months. So why dental care is important? Like I said, yes, it helps in we discover your cavities, we can prevent before you have to do some serious treatments like root canals or pulpectomies. We keep your gums healthy, and most of all, most importantly, it gives us clues about your oral infections. Oral infections gives clues about your systemic health. How it's related is there are various diseases which are associated with your basic oral health, such as endocarditis, cardiovascular diseases. Basically, the plaque present in your mouth creates an inflammatory situation. These inflammatory factors can actually travel through your blood. Your gums have a huge blood supply. It can actually travel through your gums into your systems and affect your heart, lungs. In fact, I mean, for the adults, even premature babies have been related to oral diseases like gingivitis and periodontitis. Diabetes, I'm sure you must have read, has a bidirectional way with oral diseases. So if you have oral diseases, it can cause it can actually get your blood sugars to raise. And if your blood sugars are high, they can actually inflame your gums. So it goes both ways. Getting simple procedures like scaling every 6 months will keep your gums healthy and you as well. Osteoporosis, Alzheimer's, this definitely needs more research, but there is enough proof out there that associations with your oral care remains. Okay, so yeah, this is what we were discussing, the top excuses for not flossing. Food never gets stuck in my teeth. I don't have time to floss. It hurts when I floss. My teeth are too close together. So you have a solution for everything. Flossing is basically not just to remove food from your teeth, it basically removes the plaque which forms within 1 hour of your brushing. The moment you brush your teeth, it takes just 1 hour for a plaque to form. Plaque is basically a thin layer made of basic debris, bacteria that is already in your mouth that surrounds your teeth. So floss will remove it from your interdental, interproximal spaces in between your teeth where your normal brush will not go. Time when you have to take out the time, you know it's an excuse. It hurts when I floss. That means you're not doing it properly. If your gums are bleeding, that means there's already deposit in your teeth and you need to go for your cleanings. My teeth are too close together. You can always use a waxed or a glide floss. These are the signs you should see a dentist. So lots of problems like you have cavities, you have sensitivity to hot and cold, your gums are puffy, they're bleeding, you have crowns and fillings, implants. You need to get those checked every 6 months just to make sure that they're fine, because a lot of time there are some chronic irritations which are constantly, say you have a crown and it's irritating your mucosa on your cheek, that can lead to very serious issues like cancer and things like that. And chronic irritations has been seen to lead that. So you have to get your checkups done to see that all of that are fine. Of course, aesthetics, like you're not happy with your teeth, your smile, persistent bad breath, we all hate that. So make sure you get your cleanings every 6 months. Any form of pain or swelling in your mouth during pregnancy, it's a must. Like for parents, it's a must that you have to get yourself checked. Any chewing or swallowing difficulty, it could be an issue with your temporomandibular joint. You need to get that checked. Any medically compromised situation, whether you have diabetes, you have a cardiovascular disease, an HIV patient, eating disorders, you need to see us. Dry mouth is another thing that we have been recently seeing quite a bit with the kind of food, the environment we live in. It's a must that we have a look at your teeth. Smoking or using any tobacco products, your habits basically, undergoing any medical treatment such as radiation, chemotherapy, your jaw pops, like I said, your joint problems, any form of spots or sores in your mouth. So they can be a sign for a very bigger problem. So sometimes it's just like a tiny white spot that can lead to diagnosis of a cancer. So not scaring anyone, but that's why necessary to visit us at least once in 6 months. So why dental visits are important? Like I said, there are so many cavities, so many issues that you will not have a symptom for. And just because you've come for a checking or you've come for a regular scaling, which should be done every 6 months, that we diagnose that there are these problems, which can be solved with smaller and simpler procedures like fillings or basic cleaning. However, if you delay it, which actually a lot of people tend to do, overall the problem keeps increasing, and then we have like a huge bill on our hands for one. For two, we have like a huge longer treatments requiring 2 to 3 sessions. Now, the dangers of poor oral health. I've discussed the causes, gum diseases, tooth loss, cavities, we're all aware of it. But at the same time, your poor oral health can also affect your heart, your blood sugar levels, any form of respiratory infection can happen. There can be an infection in your oral cavity, which can cause some kind of an infection in your throat, and then further the infection can travel through your bloodstream. Mouth cancer, like I discussed. So basically, it's simple. You need to brush your teeth twice. You need to floss after every meal. Make it a religious habit that you are flossing after every meal. Rinse your mouth after every meal and just brush before you go to bed. Like nothing is more important than that. And yes, visit us every 6 months so that we can give you a scaling, because that is what will remove all the hard deposits from your teeth. And we can at least give you a checkup and know that everything is fine. So yeah, any questions? Thanks. Ma'am, which toothpaste is best for teeth? Honestly, all toothpaste are. If in case you have sensitivity, I would advise a sensitive toothpaste, but it should not be used for more than a month. It tends to wear your teeth off. Are dental x-rays safe and needed? They're safe, but they're only needed when there's an issue that needs to be visualized in an x-ray. You don't necessarily need to do it for every treatment. Make your teeth white. Brush your teeth regularly, because if you're not doing that, it's going to make your teeth yellow. There are procedures which can make your teeth white, but depending if you really need it, bleaching, veneers, we'll have to have a look at you to know that. How can company of a toothpaste? Okay, so I'm not giving a brand out. You can use any of the toothpaste, Colgate, Oral-B, whichever works for you, whichever you like. I prefer paste-based toothpaste more than gel-based, because gels are a little more harder for your teeth and they tend to wear your teeth off quickly. So it's better to use a paste-based toothpaste. How often should we change our toothbrush? Every 3 months. Every 3 months, religiously. How often should we change? Same thing. How often should we? Okay. Ma'am, how can we do our teeth white? Like I answered, what is good for making our teeth healthy? Having good food, nutritious food, like something good in vitamin C. It's very good for your gums. And most importantly, like I said, oral hygiene. Like, I mean, food and all does improve your bone health and your gums and all that. But more importantly, I would stress on maintaining your oral hygiene. How can we stop our gums bleeding? You can brush regularly, and you need to get a scaling done every 6 months to stop your gums bleeding. Because once your gums have started bleeding, that means there's inflammation in your gums. So that will not just go with your brush. You need to come for a cleaning. I eat something, my jaw pains. It could be a joint issue. One Shikhand. Yeah, it could be a jaw issue, but we need to have a look at you to know exactly what it is. Daughter is 8 years old. Can use? I'm sorry, I missed that. What is good for making our teeth healthy and strong? If teeth is not coming from 1 month and it is bleeding, then if sometimes there are delayed eruptions that do happen, but it could be bleeding because the tooth is trying to poke and come out. Just give it some time, do a gum massage, it might just pop out. Else, if it delays more than a particular age, then you need to come visit us. Ma'am, after how much time we should go for a checkup? Every 6 months, like a routine, like every 6 months, your dental visit should be booked in your schedule and it should be done. And the sooner you start, the better it is, because especially with children, actually, it is said that the first time you should visit a dentist is like when the first tooth erupts. So it's that young. The younger you start, the more comfortable you're in that environment. And we can predict a lot of things, like we get ortho treatments done. All that can be intercepted at an earlier age. And with smaller appliances, lesser amount of time and money, it can be worked out. What's floss? Floss is a thread-like structure that you actually put in between your teeth and to remove things in between your teeth. Your brush will just remove the stuff from the surface of your teeth, not from between the teeth. Okay, so Ayurvedic paste, I'm not against them, but since much of research is not there, I cannot advise on one. I rather prefer a normal regular toothpaste. Can you let me know what are the best ways to practice oral hygiene at home? Brushing twice, morning after breakfast, night after dinner, just before you go to bed is like the right time to brush your teeth. You can get a floss from any chemist. And let me know what are the best. Ma'am, is paste better for our teeth? No, in terms of gel and a normal toothpaste, I prefer a paste-based toothpaste than a gel-based one. Canines are weak. What can I do? Ma'am, canines are weak. I am not understanding this. I need to have a look at him before I can advise on that. Teeth cracking. No, there's no nerve association with that. It's probably because if there is any kind of pain, that's probably because there's a cavity that has reached the pulp. For gum bleeding, again, you need to come for your scalings every 6 months. There are more procedures like root planing and all, but that is how, depending how much of an inflammation there is. If your gums are bleeding when you're brushing, first and foremost, do not stop brushing. You need to continue brushing your teeth and your gums as well, irrespective of whatever the blood is coming. But at the same time, you need to come for your cleaning. Doctor, fine to use vitamin D3, which is 25 mg. Yes, it's fine. Ma'am, Patanjali, Dant Kanti or Pepsodent? I go by Pepsodent. Sorry. I know Patanjali is quite famous, but I go by Pepsodent. I vouch for Pepsodent any day. Yeah. So I think Dr. Sumit Singh will take over now. Any more questions? You can get back to us in Medanta Mediclinic. I'm at the Defense Colony. I'm here all 6 days. And come visit us. And I know the environment is quite bad and everybody is scared to visit a dentist. But honestly speaking, this is just the place. It's not a hospital. It's a Mediclinic. We have a lot of precautions on hand and we have actually taken care, like literally taken care. Trust me, I'm just not well known the PP just to be here so that you guys can actually see what I look like. So it's high time that people should come out because everyone's ignored their mouths for a year now. So yeah, I'll see you. I have a dog. Brush his teeth really orange. I will have to get back.
मैं ज्वाइन कर सकता हूँ तो मेरे को पता है पर मेरा वो वीडियो ऑन ही नहीं हो रहा है यहाँ से.
I think Dr. Sumit wants to come. I'll just
start my videos.
Everyone, Dr. Sunit Singh, our chairman of Department of Pediatrics, is here. If you have any question, you can ask him, please, in the chat box, please.
Please, sir.
Okay. Okay.
Yes, sir. Welcome, sir.
Yeah, Abhishek, you have to read the questions for me from chat box, whatever they are.
Sure, sir. Sure.
Okay, so I'm here.
Yes.
I saw a few questions. One was related to.
Sir, a very common question the parents are asking continuously is what are the post-COVID effects and how long does it really take to recover?
Right. So I must say that children are a little more lucky that as compared to adults, the long-term effect, in fact, even during the COVID, children are affected much less. There is something that protects them as compared to number of adults who get to severe form of disease. But there is a certain group of children who, after COVID, if they get exposure to COVID again, or for some reason after 4 weeks or so, they develop a very serious form of disease, which requires nothing less than ICU care and quite a bit of treatment. That happens in just a small percent, 5% or so of children who get COVID. But remember, COVID in children between 1 year to 12 years is much less common as compared to adults, and hardly any one of them had gone to require even hospitalization among those I had seen. So in nutshell, what I would say, one really need not worry about long-term effect in children, except that, being confined at home is mentally stressful, but their lungs, etc., are not affected for a long time. The only precaution one need to take is that although they are well, but next 4 to 8 weeks could be still, there may be a second reaction to the disease. And if at that time, if they develop fever or any uneasiness or change in or breathing or fast breathing, etc., that's the time you should go to the doctor immediately. If there are rashes, but that happens in a small number of cases, as I said. But no long term, nothing to worry about, as compared to adults where the long term effect on lungs are quite significant. And those who have suffered once, a damage to lungs sometimes can stay forever. I mean, for the time that we know, for months together. Okay.
Great. Thank you for your
Uh, Kundan Singh is asking, respect Dr. Singhi, it's fine to use vitamin D3, which is 25 mcg
Yeah.
by GNC for my daughter who goes for regular running.
Right. Now, that's the regular maintenance dose of vitamin D, and that all children should be actually taking, whether COVID time or not COVID time. Because vitamin D deficiency had been shown to be linked with the more severe form of COVID. So this should be for everyone. And in fact, because you children are staying at home, there is very little exposure to the outside light, etc. Vitamin D levels are likely to go down. And therefore, this supplement of vitamin D, 1000 unit daily, is to be taken by all children. Uh, for the person who is actively running, for them also this is good enough, or going for biking or anything, because then they are going outdoor also. So that's perfect. Does that answer the question?
Yes, sir.
Okay.
So, sir, someone is asking, sir, if we go to school, we need to wear a mask
Yes.
for a long time.
Yeah.
Just a second.
So
long hours, and it's very difficult to wear a mask for us. So
so
what we can do in that case?
no, the cloth mask, as long as you are within vicinity of anyone, not really uh, uh, far from each other, more than 2 feet. If you are in outdoors, you can take off your mask for the timing. But when you are together inside a classroom, you should be putting your mask. And the cloth masks are not so difficult. We wear this mask all the time, which is very difficult to be worn for even 1 hour. So this is for your protection and everyone else's protection who is around. Once children are in school, they are likely to contract from their colleague, because COVID many times in children is asymptomatic. And so you can carry the virus without even knowing it, and then it can be taken home. So for everyone's safety at home, and wear the mask whenever you are in vicinity of other people, children or teacher. Or if you are maintaining safe distance and you are outdoor, then maybe you can take it off, but not inside classroom at any time. I'm sorry, I have not given any relief on that. That has to be done.
So, sir, a student is asking, what is the probability of having a COVID again if once you survived it? Is there any protection cover as such?
See, once you had COVID, this is actually ongoing scientific investigation that is on. Second episode of COVID had been shown in a very, very, very fraction, which means it's rare for practical purposes. You can count that it won't occur in your area. There are only handful of case reports for medical science that had come up that COVID had occurred again. But some people can have a COVID, adults especially, can have COVID going on for a long time, or their viruses doesn't die in them. That's a different thing than recurrence. But second episode of COVID in children, forget about it. It's not going to happen. Don't worry about it. In young people, also again, forget about it, because whatever had been reported were in people above 55 and so a second episode, and maybe there are other reasons for that. So uh, for practical purposes, no risk of second infection. Okay.
So, sir, someone is asking, we had heard a lot about zinc to boost immunity other than pills. Could you please suggest some food items rich in zinc?
Right. Unfortunately, zinc is not there in many food, but the best source that we Indian traditionally had been eating are almonds. Almonds have good source of zinc, but people in the past, they used to store water in zinc vessels. Even that kasa that we call, that zinc and copper, very useful way of getting zinc in the water. So we eat almonds every day, say 9 to 10 pieces every day. That will take care of zinc. Otherwise, of course, there are zinc syrup, which is much cheaper than buying almonds. But traditional wisdom of ours is, at least in this part of the world, we always kept our water in during winter, especially in copper and brass vessels. Those brass vessels, they have zinc, and then there are zinc container also for water. Okay. Then there are seafood which will have zinc. Okay.
So, someone is asking, is COVID vaccine safe for the kids?
Okay, that's a very difficult question to answer. COVID vaccine has not been tested in children so far. Now our government is taking up at this trial in young children below 14 years of age, and to establish safety of it. So one does not know at the moment whether COVID vaccine is safe and effective in children below 14 years of age. It's right now designed for all those age groups which have a bad form of disease. So elderlies, even young people after 14, they are the ones who should be getting it, and of course those on high risk. There is still apprehension in people's mind but about getting the vaccine, but I can say that it is quite safe for all other age groups than children below 14, because we don't have any data to say that it is safe or not. I presume that it will turn out safe, because children have a better way to fight any kind of invasion. So virus, if they get, they will take care of it. Or the immune response is also better in them. Okay. So,
So someone is asking, in autoimmune disorder, recurrence of COVID is possible?
in autoimmune disorders, yes,
Yes, sir.
all immune deficient people or immune affected people whose immunity is not normal, they're having a disease of more severe form is more likely. They are at a higher risk of disease getting bad. But that is not to say that it will again occur in everyone. One of my friends was on cancer treatment and he had COVID without anything. He didn't even need to go to the hospital. But autoimmunity means your body's immunity is not well regulated. It is working against your own body. And so autoimmune disorders, you do not know how they will react against the COVID virus. It can be bad, or it can be, they may not be able to fight even the virus sometimes. Okay.
Sir, one is asking, vitamin D level fell by 30% recently. Is it normal in winters?
No, then the supplements are needed. Because in winters, of course, you are not going outdoor, you are not getting enough sunlight, and the activity level is also not so good. But at the same time, the supplement, if you are taking 1,000 units a day, then it should not have gone down. In COVID and other conditions, actually, we need vitamin D to protect ourselves. And so fall of that level or lower level not only affect the bone and etc. on the long run, but even the fighting capability of the immune system. So they should take a supplement for this fall.
Right, sir. Right, sir. Right, sir. I think that is it.
Okay, children
Can't
and
see.
their parents both are invited if they have any. Is COVID vaccine safe for adults more than 60 years? Yes, COVID vaccine is quite safe for children above 60 years. Dr. Triana has already taken 2 doses. We all of us have taken second dose we are waiting for. So it's quite safe. We are sitting here and talking with you. The reactions are, very mild. Those are kind of local pain, sometimes fever. And in sometimes it's after second dose, people had a little bit more fever and body aches and pains and feeling not well for 2 or 3 days. But I can tell you it is still much better than getting a COVID, because you don't know what COVID will do to your body. Okay.
So they are asking for any multivitamins you can suggest for the kids.
Yeah, that depends on the age group, but there are plenty of multivitamins in the market, and most of them are similar in their formulation. So one goes by the taste and the composition. I find one particular brand, A to Z Complete, because as the name suggests, it has everything A to Z, including zinc. Z stands for zinc.
Right, sir. So some people are saying excess of vaccination and medicine can cause cancer. Is it true, sir?
Excess of everything can cause problems. So to say that excess of medicines, excess of eating out, excess of having food which are colored, excess of eating anything and improperly. The cancer is caused by so many factors, not just, in fact, I wouldn't blame medicine because you don't eat medicines as food, but food is your everyday intake. So your food and general habits are more likely to cause cancer.
So I think, sir, that will be all. So, ma'am, over to you if you want to say some
Yeah,
words.
sure. So now we have come to an end to a such highly successful and important webinar, and I'm so obliged to Team Medanta for sparing such valuable time for all of us to guide us how to stay healthy. I'm sure we all learned so much today, and the information shared here was truly helpful in maintaining good health. Now, on behalf of entire KIT fraternity, I thank each one of you, Dr. Singhi, Dr. Monica, Dr. Saima, Dr. Abhishek, and of course, Dr. Shubhang, for organizing such an insightful health webinar. Thank you all the parents for joining us today. We seek your cooperation now in creating a COVID-safe environment and school. And we are sure that we'll have your complete support. Thank you everyone for joining us today.
Thank you. Thank you.
Thank you, everyone.